Good morning. Today is Sunday, April 7th, 2024. There were two important items in the news recently, both of which can save lives. Now, we've discussed many times the subject of organ donation and transplantation. It is still the case that while some organs can be donated by a living person, and they are relatively safe for the donor to do so, for example, like donating a kidney, others can only be helpful from a cadaver, like heart, lung, and often liver. Now, we've discussed this in terms of Jewish law. I've shared with you and tried to explain my position in favor of donating these organs in accordance with the guidelines of Jewish law. And in fact, in those cases, it is the greatest mitzvah to do so. The problem is a shortage of organs available. And many people, thousands of people die waiting for a heart, lung, kidney, or liver transplant, and it doesn't come to save their lives. Now, one part of the problem is that these organs must be transplanted very soon after the death of the donor, a matter of hours, and that sometimes limits the usefulness of that organ. But there is a machine now in use that is extending that time window. Now, the reason the organ deteriorates so quickly once it's removed is because it needs blood flowing through it to keep it healthy. And this is called perfusion. A heart, lung, liver, or kidney needs the perfusion of oxygenated blood to stay healthy and therefore worthy, available for a transplant recipient. And now there is a machine that does that, a perfusion machine. In an article by Ted Alcorn in the New York Times recently, so he describes this scene. There's a human liver in the operating room at Northwestern Memorial Hospital in Chicago, and the liver is alive. Blood is circulating through its tissues, delivered oxygen, removed waste products, produced all of the proteins that are essential to the body, but the donor had died a day earlier, and the liver was inside a big plastic box. The organ owed its vitality to this machine, which was preserving it for transplantation into a needy patient. Dr. Daniel Borja Cascio, who's a transplant surgeon at the hospital, said, "It's a little bit science fiction." Perfusion is changing every aspect of the organ transplant process, from the way surgeons operate, to the types of patients who could donate organs, to the outcomes for recipients. Most significantly, surgical programs that have adopted perfusion with one of these machines are transplanting more organs. Since 2020, Northwestern Hospital has had a 30% rise in the volume of liver transplants. Nationally, the number of lung, liver, and heart transplants each year rose by more than 10% in 2023, last year. That is the largest year-over-year increase in decades. So, this machine, along with other advances, is making a difference in saving more lives. Because with this machine, transplant surgeons have begun to use organs from older or sicker donors that they might otherwise have turned down, because now they're able to check and to verify that the organ, once it is removed, is usable by the recipient. We're going after organs we never would have gone before. This is Dr. Chris Kroom, professor of surgery at the Mayo Clinic in Florida. We're going after organs we never would have before, and we're seeing good outcomes. Also, Perfusion eases the grueling process of organ recovery and transplant, which often includes hours-long surgeries that doctors conduct against the clock. Remember, it's a limited time window, beginning often in the middle of the night and completed in back-to-back succession. Now, surgical teams can recover an organ, perfuse it overnight in the machine while they sleep, and then, when they're rested, complete the transplant in the morning without the fear that the delay will damage the organ, which certainly makes it a safer surgery. Now, there is a significant problem with this for those who are concerned about Jewish law, and that is this opens the door to organ donation by comatose patients. Remember, a patient who is in a coma is fully alive, according to Jewish law, according to all opinions in Jewish law, even though they can't speak, they can't move, but they're fully alive. So if a family would decide to withdraw life support from a comatose patient, allowing their heart to eventually stop, and then that heart is donated to a recipient, that is prohibited according to all opinions in Jewish law. So we have to be very, very careful that that type of procedure is not going to be accepted, certainly by any Jewish person. But at the same time, this perfusion machine may have another incredible use. Now, this is amazing. Dr. Shaf Kajavji is a surgeon at the University of Toronto, and his lab is at the forefront of developing technologies to preserve lungs outside the body. So he said that this perfusion machine could eventually allow doctors, listen to this, to remove, repair, and return lungs to the sick patient rather than replacing it. He said, I think we can make organs, fix organs, that will outlive the recipient you put them in. Incredible. So listen to this by Dr. Ashish Shah, chairman of cardiac surgery at Vanderbilt University. It's one of the busiest heart transplant programs in the country. And he said, here's how it works. He said, your heart's broken. Physically, not emotionally. Your heart's broken. I take it out. I put it in the perfusion machine. While you don't have a heart, I can support you with an artificial heart for a little while. I then take your heart and fix it, and then I sew it back in your own heart. That's what we're really working for. Wow. Amazing. Okay. The second piece of news is that this past Wednesday, Richard Slayman left the hospital and went home. Now, that is astounding news because Slayman is the first patient to receive a kidney transplanted from a genetically modified pig. His doctors say the transplant and its encouraging outcome represent a remarkable moment in medicine, possibly heralding the era of cross-species organ transplantation. You remember we've discussed this a couple of times in the past about the promising possibility of genetically altered pigs to be able to harvest their organs for human beings. You remember we discussed last year a heart transplant from a genetically modified pig. It did work for a few weeks, and after that, the patient did die. But the kidney that was transplanted into Richard Slayman, who's 62 years old, is producing urine, removing waste products, balancing the body's fluids, carrying out other key functions. And Richard Slayman said, this moment, leaving the hospital today with one of the cleanest bills of health I've had in a long time. This is a moment I wished for many, many years, and now it's a reality. So what this means is the procedure brings the prospect of xenotransplantation, that's animal to human organ transplants, significantly closer to reality. Though Dr. David Klassen is the chief medical officer for the United Network of Organ Sharing, he said, though much work remains to be done, I think the potential of this to benefit a large number of patients will be realized. And that was a question mark hovering over the field, which we discussed a couple of times in the past. Yet the medical potential for pig to human transplantation is tremendous. Now, of course, there are obstacles, there are challenges to overcome, there is much more research to be done. But if this could be scaled up and integrated into our healthcare system, many more lives will be saved. And as we have discussed before, this is permitted according to all opinions in Jewish law. Yesterday, in the Parsha of Shmini, we learned the Torah prohibition on eating a pig, but we are allowed to benefit in any other way. It could very well be we are finally seeing a life-saving reason why God created pigs: to save human lives. And I've said this before, don't ever make fun of or denigrate a pig, because one day it just might save your life. My friends, I wish you a great day, and I look forward to seeing you soon in person.